Good morning and welcome. Thank you so much for joining us here in Lagos, Nigeria. Our major attention this morning would be on the health sector. Of course, you are aware that health is truly wealth. Well, the World Health Organization, WHO, has declared the outbreak of a new coronavirus in China a global health emergency. The WHO Director General Tedros made the announcement at a press conference in Geneva. Well, WHO's emergency committee on the epidemic had reportedly met last Thursday and recommended designated outbreak of the public health emergency of international concern. Well, here in Nigeria, the Nigeria Center for Disease Control, NCDC, says the country is not under serious threat for now regarding the virus HMPV. Now, joining me this morning to have a look at this virus, everything you need to know. Is it related to the COVID? What are the similarities? What are the differences? Regarding the HMPV is Dr. Idowu Jadesola. She is the Chief Operation Officer, AXA Mansard Health Limited. Good morning and thank you so much for joining.
Good morning, madam. Nice to be here with you.
And you look great.
Thank you. Good morning.
Okay. So now also joining me virtually from Abeokuta this morning is Dr. Adetonwa Festus. He is a medical practitioner. Good morning, Dr. Festus, if you can hear me.
Yeah, good morning, madam. Good morning, our listeners at home. Thank you.
Right. So let me start with you, Dr. Jadesola.
Yeah.
When we say HMPV, what does it even mean?
Thank you. HMPV, good morning audience once again, is human metapneumovirus, HMPV for short, and it's a respiratory virus which is a newly discovered one that recently was isolated in China, and is one of those common viruses that are in circulation. So basically it's not new, but it is rising in some cases in places like China, which has been brought to the attention of WHO. So basically it's a respiratory virus, and of course symptoms range from flu-like symptoms, mild flu-like cold, common cold, to severe respiratory infections and diseases, even leading to shortness of breath. So basically it is a respiratory virus.
Right. Let me move over to Dr. Festus now, if you can hear me. So Dr. Jadesola said it's a flu-like virus, and of course you are aware that right now in the country and in some parts of the world, this is a period where we have, the winter happening, we have Hamatan sort of happening in some part of the country. So how do we differentiate the flu-like symptoms, which actually is a norm, to the HMPV?
Yeah, thank you so much. So, like you just said, is for human metapneumovirus is just presents usually like the common colds. Let me put that word, the common colds that people have regularly. So it's actually going to be a bit dizzy and getting to differentiate which is which at this period of the time, knowing fully well that this is the flu period everywhere. So what the caution just calls for is simply that once you have anything flu-like, any symptoms, the respiratory tract symptoms, you're having running nose, you're having fever, especially fever that is not responding, that is persistent, and you're having a headache, body aches, things like it's presented the way almost like the COVID-19 that we had. So it just called for attention that once you have taken the routine on the cancer drug that people take commonly for feel like the symptoms, it's better you present in the hospital so that the necessary steps and evaluation can be done so that we can nip it on the board early. But the major problem with this kind of virus is if it's not been attended to on time, it becomes well established within the system, especially different people with different health status. So if you have someone that is immunocompromised or someone that has some chronic health conditions, if they're having such, they don't have to just trivialize moving fast to the hospital. Basically, that's just the way you can just differentiate them. for now.
Now, still on trying to differentiate and also trying to find out how it manifests, what other ways does this virus manifest aside from the flu-like symptoms? Are there other things persons should look out for?
Yeah, like I said earlier on, so for someone that is having is unstabilized health condition, or if the disease, if the person is infected and is getting progress within the system, somebody can be having difficulty in breathing. It can present like wheezing, like we have in these asthma patients and other respiratory chronic obstructive pulmonary disease people. So if you start having difficulty in breathing, you start having wheezing, and to the extent that the fever becomes so persistent, then you need to present. It's showing that there's a progression in what we think is common. Like I said, it's a common cold. So you want to actually take a further steps on that. Even for someone that is not having any chronic diseases before, or someone that is not having any, is not immunocompromised, and you just started having common cold, and suddenly you see that because it's just supposed to be a self-limiting disease, so and it's suddenly turned out to be presenting in a way that it turns to you having a difficulty in breathing, get tired easily, and there's wheezing. What I mean by wheezing, when you are breathing, you start to hear the sound of your breathing, which has never been like that before. So it's advisable for such a person to take a further step of presenting the hospital for further evaluation.
Right. Now, back to you, Dr. Jadisola. The HMPV, is it similar with COVID-19?
Yes, it is. I mean, they come from the same big group called the corona, virus group, but it is not the same thing. And virus studies are the ones that can isolate it. So luckily, the NCDC has some labs, that can isolate it. So COVID-19 virus is different from the HMPV virus, but you can only isolate it through those virus studies, and laboratories have been designated in the 6 geopolitical zones that can test for this virus and isolate it.
So what are the differences between this particular HMPV and COVID-19? Because we're also aware that there is no vaccine for HMPV at this point, and when we had COVID, we saw at some point vaccine was actually, created.
So basically, we call them systemic and constitutional symptoms. The same common cold, flu-like symptoms, leading to wheezing or respiratory distress or nasal congestion. So basically, they have the same symptoms. The only difference is in isolating the virus to say this is HMPV and this is COVID-19. And right now, the labs are set in preparation by NCDC to isolate. But right now, I must say that Nigeria is not, we've not isolated any case, and though the risk assessment has shown that Nigeria is on a moderate risk, the airports and many of these point of entry places have been put on alert to isolate anyone presenting with any of these respiratory symptoms so that they can be tested right there at the point of entry.
Okay, so just recently, the Nigeria Center for Disease Control, NCDC, says Nigeria is currently under any serious threat for now. That the country is not a cause for alarm at this point regarding the HMPV. But I would love Dr. Festus to run us through NCDC's stance on this virus and how prepared Nigeria is, just in case we see anything come up.
Yeah, thank you so much for that. Yeah, like I'm privy, I'm part of the stakeholders for the NCDC, and I can tell you categorically that since the global pandemic of COVID-19, a lot has been put in place through the NCDC in conjunction with other government stakeholders. A lot of healthcare workers have been trained, a lot of information has been given to the community, what we call the risk communication. What are the basic things that people need to get to know about whatever types of diseases that we're having, like we have for this HMPV now, and also what are the preventive measures. All these have been taken care of since the pandemic. So I want to believe generally that this is not going to catch us unaware like we had for the COVID-19. And part of the basic things that is ongoing now, which I'm very much aware in most of the health facilities and in most of the health institutions where we have health workers getting training on daily basis, are emphasis on what is called infection prevention and control, which is commonly called IPC. And basically that survives to cater for everything. And that's what has been pushed for over the years. That even during the Ebola period, the Lassa fever period, during the COVID-19. What actually saved us a lot was our proactiveness and our rigorous approach to enshrining or taking us back to what culture of IPC is, and which I believe so far so good. Since that last pandemic, Nigeria has done very wonderfully well, and we are prepared. And the basic things are how can one get infected? That information is out through the respiratory tract infection. When you're with a sick person or you're sharing a small space with somebody that is sick, where you can easily get the droplets, or you touching the commonly touched surface areas, the handle of the door, anything, tables, everything. So the basic things is for somebody to do what is called hand hygiene. So by hand hygiene, there are two basic ways. One, and washing with soap and water on regular basis, or this ABHR, alcohol-based hand rub that we only have the sanitizer, that commonly called sanitizers. So once you have all these at your beacons and you move around, when you are in an exposed place, you use your mask, the medical mask, you cover yourself. For someone that is also sick, that you know that you are sick, you have to do it, what is called saving your brothers, be your brother's keeper as well, by doing the needful on your own. If you know that you're seriously sick, that you can decide to stay back indoor until you get
Right.
well or present yourself to the health facility, or you use your face mask when going around.
Now, one would begin to think and imagine, should Nigerians be concerned and worried at this point? Of course, we know that NCDC says there is no cause for alarm, but, just honestly speaking, how should Nigerians take this at this point? Because we saw what happened during the lockdown in 2020. We saw how that affected us, not just here in Nigeria, globally, and how it also affected us economically as well. So what should Nigerians' stance be on this right now? Dr. Festus, if you can hear
Sorry.
me.
Oh, sorry. Yeah, I'm just
Right.
hearing you now. I love the. What's the question, please? Come again.
Okay, so I was actually saying that what should Nigerian stance be on this? Should we be worried? Should we be concerned regarding the whole
Oh, okay.
situation currently happening in China?
Oh, okay. Like I said, and like the NCDC has brought out their position on behalf of the government, there's nothing to be panic about. There's nothing to worry about. But unlike some myths and rumors that we had during the COVID-19, so people tend to lose interest when it comes to information that affects the reality of the populace in terms of health. So I just want to advise people to be calm, should not panic, but they should follow strictly the information, the precautionary messages that are being taken around both on national televisions, on social media, and people tend they need to see. You could imagine during those COVID-19, there are a lot of myths and rumors. People saying somebody should take salt, different things, but they should look for the genuine sites where they can get correct information. Like we have NCDC is making them available, so there's no need for panic. There's no need for
Okay.
being worried. People should just follow what is being mentioned.
All right. Now let me move over to you, Dr. Jadisola. Who's affected in this particular virus? The babies, children, or the elderly?
Everybody can be affected, but the people that are most vulnerable are the young children under 5, the older people, older population above 60, 65, and anyone that is immunocompromised, anyone with underlying illnesses like diabetes, like cancer treatment, like HIV, or any of these the chronic diseases
So,
are most affected. But anyone can be infected with this virus.
so how can we protect ourselves? What are those cautionary measures Nigerians need to take at this point, regarding this virus?
Yes, thank you for that. This is so important. The same measures, personal protective equipment that we instituted during COVID, which are still, standing in many of our states, including Lagos State and many states, is what we will still institute. Number one is what we call hand hygiene. The same hand hygiene, hand washing, regular hand washing, very important. Everyone should also get a sanitizer. You're going to public places, try and avoid touching the railings and get a sanitizer you can always use all the time. Respiratory hygiene means you're coughing, or anyone coughing should cough, and this is what we demonstrate, not coughing out in the air, because as you cough out in the air, that's how the infection spreads.
And not even coughing with your hand closed.
No, it should be with
Okay.
your arm under the elbow like this to
Right.
cough. Respiratory hygiene, and of course avoiding overcrowded places. This is not the time to be going for parties and staying in overcrowded places. Close contacts too that have any illness, respiratory illnesses, also need to be isolated, even at home, because now until you do any virus study, you can't confirm which virus they are incubating. It could just be the common cold, but it could also be the HMPV. Anyone coming from these isolated countries like China should also be put on alert. The incubation period is about 2 to 5 days.
Right.
And then because it's a self-limiting virus in most cases, and in most people with strong immune system, in 2 to 5 days also symptoms resolve even without treatment. I mean, like you know, and you said, there is no vaccine, there is no specific antiviral treatment, but what is recommended is what we call management of symptoms, just self-limiting. So basically you treat the fever, treat the cough, and then rehydrate the patient. So basically symptomatic treatment is what we call it. We just treat the symptoms,
Okay.
and gradually the symptoms resolve.
And also worthy to know that it is not in Nigeria at this point. We're just having this conversation so that you be aware of what is going on globally and also how to protect yourself just in case. I have been speaking to Dr. Idowu Jadesola. She is the Chief Operation Officer, AXA Manted Health Limited. Thank you so much for coming today.
Thank you, madam.
And also from Abeokuta, who joined virtually, Dr. Festus Adetonwo. Thank you so much for coming on the program this morning.
Thank you so much.
All right, so hopefully we get to have another time to also enlighten you and keep you up to speed with the latest of development regarding this issue. Just stay safe and be good. I am Anu Stephen.